We will now be doing resting blood pressure. For this procedure, you will need a stethoscope and a sphygmometer. For this, you will have your patient, Kelsey, seated in a chair for at least 5 minutes. Make sure the chair has back support. Her feet need to be flat on the floor, not crossed. Her arms need to be at heart level. She should refrain from smoking cigarettes or ingesting caffeine for at least 30 minutes before this. Did you do that?
Yes.
Thank you. We will begin by wrapping the cuff firmly around her arm. We need to ensure that we have the right cuff size. Oops. Make sure you're wrapping around the upper arm. Align the cuff with her brachial artery. Right arm, brachial artery. You want it snug, but enough so that one finger can fit in there. Make sure the sphygmometer pump is closed. Place the stethoscope over the brachial artery. Do not place it under the cuff. Quickly inflate your cuff to about 150 to 160. Slowly release at about 2 to 5 per second. To ensure accuracy, do 2 measurements. Between measurements, you should wait at least 1 minute. We will now be doing resting heart rate. For this, you should have your patient sitting upright, legs uncrossed, with back support on the chair. For best results, this should be done in the morning before getting out of bed. You're going to find her radial artery, and you're going to use your index and middle finger. Do not use your thumb because it has a pulse of its own and you could get confused. You're going to measure for 1 minute and count how many beats you feel. Be sure to relay the results to your patient, both written and verbally. Kelsey, your resting heart rate was 72 beats per minute. We will now be performing waist and hip ratio. For this, the individual should not be wearing clothing or other items that might interfere with the measurement. They should also, if they can, take their shirt off so their waist and hip area is exposed. The waist portion should be taken at the narrowest part of the waist. The tape measure should be wrapped snugly around the body, but not to the point of depressing or pinching the underlying skin. The hip circumference is measured in the same manner as the waist measurement. However, the tape is passed around the hips at the widest circumference of the buttocks. In this case, please ensure that the tape measure is not pinching either. Once the measurements have been taken, the waist to hip ratio can be calculated by dividing the waist circumference by the hip circumference. The subscapular skin fold is a diagonal fold at a 45-degree angle, 1 to 2 centimeters below the inferior angle of the scapula. The tricep skin fold site is a vertical fold. It is on the posterior midline of the upper arm, the right side, halfway between the acromion and olecranon processes. The chest skin fold site is a diagonal fold. It is on 1/2 of the distance between the anterior axillary line and the nipple for men. The abdominal skin fold site is a vertical fold 2 centimeters to the right side of the umbilicus. The suprailiac skin fold site is a diagonal fold. It is in line with the natural angle of the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest. The mid-axillary skin fold is a vertical skin fold. It is on the mid-axillary line at the level of the xiphoid process of the sternum. The thigh skin fold site is a vertical fold. It is on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease on your hip. We will now do the procedures for the skin fold site testing. The procedures are as follows. All measurements should be made on the right side of the body with the individual standing upright. The caliper should be placed directly on the skin surface, 1 centimeter away from the thumb and the finger, perpendicular to the skin fold and halfway between the crest and the base of the fold. Pinch above the caliper. A pin should be maintained while reading the caliper. Wait 1 to 2 seconds, not longer, before reading the caliper. Rotate through all the measurement sites so that way the skin has time to regain normal texture and thickness. Then repeat duplicate measurements at each site. If there is a measurement that is not within 1 to 2 millimeters, retest again. We will now perform 1 rep max bench press. For this, you will need a bench. Since our individual is a male, you will use a 45-pound bar and 2 spotters. The spotter helps the individual unrack and re-rack the bar. The individual starts all lifts from the up position with elbows fully extended. The bar is lowered to the chest and pushed back up. To begin, the individual will warm up with a light resistance that will easily allow him 5 to 10 repetitions. After he's lifted, provide a 1-minute rest period. Next, estimate a warm-up load that will allow the individual to complete 3 to 5 reps by adding 10 to 20 pounds, then provide a 2-minute rest period. Next, estimate a near maximal load that will allow the individual to complete 2 to 3 repetitions by adding 10 to 20 more pounds. Provide a 2 to 4 minute rest period. Next, the individual needs to determine whether he is ready to attempt his 1 rep max. Increase his load by 10 to 20 pounds. Instruct the individual to attempt their 1 rep max. If the individual is successful, provide a 2 to 4 minute rest period and go back and add on another 10 to 20 pounds. If the individual is unsuccessful, provide a 2 to 4 minute rest period and decrease the load by 5 to 10 pounds. We will now do a test to test muscular endurance. We will be doing the push-up test. Megan is going to be in the female position, which is the knee push-up position. Her legs are together, her lower leg is in contact with the mat, and her ankles are plantar flexed. Her back will remain straight, her hands are shoulders width apart, her head is up, and she's using her knees as a pivotal point. She will raise her body by straightening the elbows and return to the down position until her chest touches Kelsey's hand. Her stomach should not ever touch the mat. She will keep her back straight at all times and must push up in a straight arm position. She does this until she is unable to maintain the proper technique within 2 repetitions. She may rest at the top in that position if she needs to. We will now be performing our second muscular endurance test. For this, we will be doing the curl up crunch test. First, Kelsey will assume the supine position. Her knees will be at 90 degrees. Her arms are at her side, palms facing down, with the middle of her fingers touching the piece of masking tape. The second piece of masking tape is placed 10 centimeters apart. Her shoes will remain on during the test. For this test, you will need a metronome. The metronome is going to be set to 50 beats a minute, and Kelsey will do slow, controlled curl-ups to lift the shoulder blades off the mat. Her trunk will make a 30-degree angle, and she will do this in tune with the metronome at a rate of 25 per minute. The test will be done for 1 minute, but her low back should be flattened before curling up. Kelsey will perform as many curl-ups as possible without pausing. She will try to do a maximum of 25.